Combating diabetes through lifestyle habits is more than just reducing the intake of sugar. Let's talk about this on this episode of The Daily Dose. Do you have diabetes? Or do you have family members who have diabetes? Or maybe you are just generally concerned about diabetes and want to do everything that you can to prevent diabetes. If you are any of the above, this video is for you. Watch on. Hi guys, welcome back. If you're new here, I am Dr. Chan. I am a medical doctor from Singapore. In my work, whether as a medical doctor or as a trainer and coach, I often deal with people with diabetes. And one of the very common misconceptions amongst people with diabetes is this, that many of them think that all they need to do in terms of lifestyle change is simply to cut down the intake of sugar in their diets. So, what do you think? Is cutting down the intake of sugar the only thing that people with diabetes need to do? What about other lifestyle habits? What other lifestyle habits do you think are also important in combating diabetes? Type your response in the comments section below. So, what was your answer? What are the other lifestyle habits that would influence the health outcomes of people with diabetes? What was your answer? Here's my answer. Cutting down one's intake of sugar is an obvious first step, but it is not the only lifestyle habits change that people with diabetes need to do. For people with diabetes, eating habits change is a no-brainer, a must-do, regardless of whether they are already on medications or not, regardless of whether their blood sugar is already well controlled or not. Eating habits change and improvement is critical in winning the battle against diabetes in the holistic sense, beyond just achieving good blood sugar numbers. But eating habits change and improvement for people with diabetes is more than just cutting down sugar intake. There are many aspects of one's eating habits beyond just sugar intake that would determine the eventual health outcomes of people with diabetes, especially with regards to preventing and combating the many complications of diabetes, which is actually one of the most important goals of people with diabetes. Therefore, people with diabetes should work closely with their doctors to identify areas in their diet, aspects of their eating habits that needed changing and improving. From my experience in coaching diabetic patients to make dietary habits change, every diabetic patient has different health and medical conditions, and they also have different eating habits. So the change that they need to make are also different. So we must go beyond just a generic take less sugar, exercise more kind of approach to lifestyle change for people with diabetes. It is important to identify areas of eating habits change that are more critical and specific to each individual, specific to each patient with diabetes, and then equip them and coach them to make the necessary changes. So people with diabetes must go beyond just cutting down their sugar intake. They should work closely with the doctors to identify specific areas of their diets to change and to improve. So beyond eating habits, what other lifestyle habits are important for people with diabetes? What do you think? What was your answer just now? Exercise. Exercise is the next obvious one when it comes to health and especially in combating diabetes. But we must also look beyond what people generally define as exercise, such as running or going to the gym. We must actually look at the entirety of one's lifestyle and habits that would impact one's level of physical activity every single day. So far, we have only covered two lifestyle habits that are important for people with diabetes. The two common and obvious ones, diet and exercise. And because I want to keep each episode of the Daily Dose bite-sized, I think we only have enough time to just briefly mention another two more lifestyle habits that are important for people with diabetes, and then cover them in greater detail in future episodes of the Daily Dose. So, beyond exercise and diet change, what are 2 other lifestyle habits that you think are important for people with diabetes. If I were to choose, I would choose sleep and stress-related habits. People with diabetes tend to underestimate the impact that their sleep habits, stress levels have on their health, especially with regards to their risk of developing complications of diabetes in the future. So in this episode of the Daily Dose, I hope I have highlighted that reducing one's sugar intake is not the only thing that people with diabetes need to do. It is the first and obvious thing. If they want to win their battle against diabetes, they must do more than that. People with diabetes should look at their lifestyle habits holistically and identify specific areas of improvement, especially in the areas of diet, exercise, sleep, and stress management. I am Dr. Chan and I am on a mission to awaken people to the power of habits. Take care and have a blessed day.